right, welcome everyone. Let's get started. So today we brought two PNHP doctors and two SNaHP leaders together to talk about how the chapters can work together. And so each of us will introduce ourselves. I'll go first. My name is Alankrita Siddula. I'm a fourth-year medical student at Rush University in Chicago, and I'm a part of the SNaHP Executive Board. I recently was previously was a leader of the SNaHP chapter at Rush, and then I worked with multiple chapters in the Chicagoland area to kind of form a coalition of SNaHP chapters and work with the PNHP National Office in putting together the AMA Action of 2019, and am now currently on the executive board for SNaHP.
I can go next because I'm the next student. Hi everybody, my name is Ashley Lewis. My pronouns are she, her, and I'm a fourth year MD PhD at NYU in the PhD world right now, and I'm also on the executive board of SNaHP with Krita. I have also done leadership at NYU SNaHP, and I'm on the New York Metro executive board for PNHP, and I've worked with a lot of SNaHP chapters across the city and help create new chapters, and I work closely with Danny as well. So excited to talk about collaboration between PNHP and SNaHP more.
So Dr. Lugassy, you can go next.
Sure, thank you, Krita. Hi, everybody. My name is Danny Lugassy, he, him, his. I'm an emergency medicine physician and medical toxicologist at NYU Bellevue and the VA hospitals in New York City. My start with PNHP is 20 years ago now as a first-year medical student at SUNY Downstate in 2001. That's right. I reached out to a PNHP New York Metro chapter because I just got into medical school and I didn't know how the hell my patients were going to pay for the care that I was learning to soon one day provide for them. And so I went to a PNHP New York Metro meeting and met the executive director, Joanne Landy, who I think some of you on this call know, unfortunately passed away a few years ago. And she helped me start the first medical school chapter at SUNY Downstate. And I'm so excited that it became bigger and greater as far as including other healthcare professions and, you know, what is SNaHP today. So I've had a long journey and really just a pleasure to be here with everybody. Thank you.
Dr. Bruno, you can introduce yourself.
Well, thanks, Krita. Richard Bruno here, he, him. I'm a family medicine and preventive medicine doc in Baltimore, Maryland. I work at a federally qualified health center and do a lot of work with HIV folks and transgender folks. And I got started at my first year of medical school as well, like Dr. Lugassy. And I went to my first PNHP meeting in 2009 and became involved at that point. Helped start a PNHP chapter at my school, and then helped start up SNaHP back in the day. And really excited that it's expanded to 85 campuses all over the country now. And I served on the PNHP board for a while, and I'm currently a board advisor.
All right, thank you so much, everyone, for joining us today. We kind of wanted to just start off with discussing some things that are always brought up when we speak about SNaHP and PNHP working together. First, we want to acknowledge the obstacles that kind of prevent SNaHP chapters and PNHP chapters from collaborating. And all of us have like different experiences that, you know, lend itself to understanding exactly what these obstacles are. So I guess I'll open it up to our speakers to kind of share what they see as situations that make it hard for the chapters to work together.
I can maybe start for a few things on the student end of it, and then we can kind of talk more about things broadly. I think the two things that come to mind that can introduce, I think, some maybe not tension, but some obstacles, as you mentioned, Krita, to collaboration is as I think we all know, the time constraints are really difficult at all levels of training for health professionals. But I think, especially when you're just starting out and you're trying to navigate like entry into this field, so like at the student stage, I think that's really difficult. And there's like, as well as for students, um, who are all often our SNaHP students are also involved in a lot of other social justice work. So figuring out, I think, how we have capacity for this at various stages of training is something that hopefully you get better at as you get, more involved. But I think at the time, it's just that's like something that's really difficult. So especially if you're a SNaHP leader, having to navigate your responsibilities to the chapter and then having to add something else onto that, like working with an entirely different chapter, like a PNHP chapter, can be really difficult. I think the second thing is, I think at times it can be difficult to get, and I guess relatedly, out of that kind of hierarchical space that we often inhabit in the medical school training side of it, and really throughout the medical infrastructure in general. But definitely I think in the training side, when you are 8, 10, 12 hours a day, the lowest on the rung, when you want to kind of hop into the PNHP organizing, I think it can be difficult to break away from those dynamics and either not feel intimidated or figure out what your place is when you're dealing with people who on most of your daily interactions would be very senior to you. Figuring out a more like, I think, just an easier way to kind of break down some of those either self-imposed or kind of already existing feelings of intimidation or hierarchy, I think would be really helpful. So that's just two first things I think of.
Yep, as Ashley mentioned and Kelsey put in the chat, I think SNaHP students tend to have a difference in the issues they want to cover. They don't tend to be very singular in the vision that they have for their advocacy. So it's, of course, very difficult to kind of promote, not just on campus, but with other physicians, just this idea of single payer alone without talking about all the other issues that are part of it, housing justice, racial justice, disability rights, etc. So I think there's so many ways that we are pulled in what we want to do and what we want to dedicate our time to. It can be difficult to also then navigate relationships with physicians in working with the physicians for a national health program chapter. And then there's just turnover. We only have 4 years to dedicate in medical school, that we have some time, and then residency kind of steals away a lot of free time. And it is a serious time when we do have to dedicate ourselves to training to become good physicians. So it's understandable, but I think, I think there's a fall off after SNaHP into continuing to stay active within PNHP as a resident. So it becomes difficult for us to work with younger doctors since there's not as many, and to really be able to see the full spectrum of, of a physician's career as we're working in PNHP and SNaHP.
I'll add a little bit to that. I mean, I think one thing maybe if people can throw in the chat that I'd be curious about, I recognize some names and faces. So I don't know if folks are coming necessarily from the SNaHP side or the PNHP side. And obviously I've been on both sides of that organizing. And I think, I feel very privileged and lucky to have such an active PNHP New York Metro chapter in the New York City area, and then obviously connected to a lot of medical schools. So I had pre-pandemic gone to SUNY Downstate, Cornell, Columbia, in addition to doing talks at NYU. And I think maybe we were a little narrow-sighted thinking that, geographically was the way that we could connect with SNaHP students and medical students. And obviously, I think this time, and obviously the meeting that we're literally in right now virtually, has kind of broken down some of those barriers. We've heard time and time again from SNaHP students, I live in a state with no chapter. I live in a state with very few folks who organize around single payer. So I would say an overarching theme for both SNaHP and PNHP members is we should just have a conversation with folks, reach out one side to the other. Connecting with somebody is so vital. I was just talking to SNaHP students, two of them, the leaders at the NYU Long Island College of Medicine. It's a new 3-year medical school that's a primary care focus. And it's just important for people to have a connection. And I think for our chapter, students have been so important at not only opening our eyes up to different issues and different ways to promote and organize around single payer, but they really just bring a lot of excitement and energy that over 20 years, quite frankly, with a lot of ups and downs in the single payer movement, has been tough. And I always find it invigorating to work with the students. So.
Yep. But despite these obstacles, I think PNHP doctors have found a way and SNaHP has found a way to collaborate across the road with PNHP chapters and PNHP doctors. Simply just having a faculty advisor that is a PNHP doctor helps, but in schools and areas like rural medical schools where they don't have that option, I think it's very useful to be able to connect with a PNHP doctor and have them as a mentor. And have someone that they can turn to for the yearly single payer 101 talk that we encourage SNaHP chapters to have for new students every year. But there's other areas that we can collaborate on outside of this annual single payer 101 talk if we kind of want to get into those areas of collaboration. I think something that was mentioned to me before was I think as students who are at school and involved with not just transforming medicine, we also very invested in working with our administration to transform the curriculum that we have, and a lot of that was seen in this past year when it came to racial justice and really pushing for understanding of social determinants of health in schools and acknowledging racial bias in medicine. And so there was a lot of push from a lot of medical students to change curricula to see this. And I think there's been separate chapters, SNaHP chapters, that have also been pushing to make sure that single payer is covered in curricula. So I think that's one area that we can definitely collaborate and make sure that we connect with PNHP doctors to get their help in this, especially if they're academic doctors that have been in institutions, have a better understanding of how to go about doing this.
I'll also add, because I think I guess relatedly to curriculum, for just having the 101 talks, right? Single payer 101 or I guess any nuts and bolts presentations. And I can, I guess, only speak from the NYU side of it, but I find having somebody like Danny or any of the other speakers we've invited who are super knowledgeable, have done this work for a long time, and also is part of the faculty is really important for persuading people who are kind of on the fence, because although it's I know it's dramatically different than the environment it was 20, 15, 10 years ago about being a single payer advocate in medical school, it's a lot better in many ways than it was in the past. It's still, especially when you're in maybe a corporatized medical school, there's still a lot of opposition, or if you're in an environment where it's a little bit more hostile politically, having that faculty member or even an outside speaker, it brings you credibility that you don't feel like you have as a trainee to speak on issues, because you are learning. You don't know everything about the healthcare system. You don't know everything about why single payer would be great. So having that, not only a person as a resource so that you can learn from them, so then you can kind of transition into that, it's in the interim, it gives you just more confidence, I think, to not only work at school, but also just kind of start branching out. I know for me, the best thing about being a SNaHP student with New York Metro in general is just also just the community it brings and the resources in general. I feel I've in general just become a lot more knowledgeable organizer and a more effective organizer. But yeah, I think when you're just initially just trying to learn and become an organizer or an activist in medical school and beyond, you need those mentors to give you the knowledge and also the confidence to do it.
Definitely. I think those mentors are really an important role, Ashley, and they also can provide a little bit of stability and continuity between chapter leadership, as students are going off to the wards, and, the first or second years are sort of taking over the reins for their individual SNaHP chapters. I think it's really helpful to have somebody around to sort of like help with some institutional knowledge and help talk with those new students about their ideas and help them flesh out their plans for leadership. I just did that for the Johns Hopkins medical student chapter last week. So they had, we're bringing all of their great ideas, and we kind of talked it out, hashed it out, and figured out, how we were going to get more students involved in the fall, hopefully, as things start to get a little bit more integrated and we can actually meet in a lecture hall and not just do Zoom meetings all the time. So they had a lot of great ideas, and I wanted to support them through that. And obviously told them that PNHP is a great resource to be able to have these kinds of 101s, but also talk about some of the efforts that are happening sort of on the city level, with Baltimore City Council entertaining an endorsement of a Medicare for All system, a resolution coming through City Hall, which would give them opportunity to give testimony. Also on the state level, with the single payer bill being brought to our state legislature, opportunity to testify or write an op-ed or get involved with those kinds of efforts. So they were very interested to get more students involved on that level as well.
Yeah, so it certainly sounds like, we have the tangible things, funding, providing, being there as a speaker for an event, but we also have some intangible ways that PNHP doctors can definitely work with SNaHP students and help by being a mentor, being someone they can turn to for help with administrative issues or legal aid, whatever it may be. I think it's been really useful to have a higher up, since we're in such a hierarchical society, that can be someone we turn to for resource and help and support. I think it'd be good if we lay out some good examples of collaboration between PNHP and SNaHP chapters to really provide an idea of how it's been done in the past and ways that PNHP and SNaHP chapters currently that don't work together can start working together. So I think Ashley, mentioned that NY Metro has a lot of student involvement in PNHP. So I'm going to let her speak to that.
Yeah, sure. And Danny can hop in as well, because he's involved in New York Metro and NYU and the student side of it a lot. But something that I feel has been really critical to having successful collaboration between students, chapters, and PNHP chapter in the New York City area is just like really concrete roles that students play in the PNHP chapter. So the first is that we have a pretty high number of student representatives on the board. So I think like maybe it's around a quarter or a fifth of the board is comprised of students. And it's a really great way of getting people continuously involved, especially as they get into the wards, because it's not as like big of a responsibility as having a chapter where you're having to do things like every week, and it can be a little bit more flexible, but you're still involved, you're still know what's going on, and you have some like role in playing in the direction of what your chapter. And in the case of New York City, we're also very involved in the state level work, so you have like a connection to legislative work or more grassroots work. So it's, I think, a good way for students to have continuity across their training and being involved. And it also makes it easier to be involved because you have a concrete role, right? You don't feel like you're out of place. You don't feel like, am I allowed to speak here? Am I not allowed to speak here? You were invited here and people asked you to be here because they want to know what your thoughts are and have the student input. And I think that environment is very clear, at least in our chapter, that they want to know what students think and the student perspective. So I think that's like really critical. And then I think on just a purely logistical level, as well as I guess leadership development as well, is that we have like a student liaison, which is a role, I don't know, I guess the technical aspects of the role, but they are, I think it's employed by the New York Metro chapter it's like a fellowship per year where we have a SNaHP student, 1 or 2 SNaHP students who serve to communicate between the board and also organize all the chapters, because we do have a lot of chapters in the New York metro area. And this has really, really helped not only the SNaHP chapters really connect across chapters. So we'll hold like joint events. We often are going to events with each other. We have like a really strong coalition together as like our chapters, but we also are very connected then. It's very like back and forth between what's going on the board. Like students can get a lot of access to speakers or other resources from the board because of our student liaisons who do tremendous amount of work in any given year. And then also like, you know, we also can communicate if there's issues on our end, if we need help or anything like that. So I think that having concrete roles, either representation on the board or a specific SNaHP student per year that's designed to facilitate that communication, and there's like clear reasons for that role, really, really help get campaigns. You know, we have students, as Dr. Bruno mentioned, like we've had students who testify for the New York Health Act in our case, testify for city resolutions. Really, like it enables like a lot of easy mobilization as well, because students have sometimes a little bit more flexible schedules. So if you know the PNHP chapter wants to hold an event, it's very easy to get a lot of students to come at a pretty, you know, quick basis, because we have that kind of back and forth. So yeah, so that's I think the gist of it. Maybe that was a little bit too descriptive, but maybe Danny, if he wants to comment on what he thinks about our setup. I think it works pretty well. Obviously, I guess it could be improved, but I think it's been very effective.
No, I think it's been great, Ashley. And the only thing I will just say is just kind of double click or just highlight again, maybe if you don't already have a student, whether it's medical student, nursing student, other health profession student on your board of your local PNHP chapter, let's think about how that can happen. There's so many benefits for both the whole chapter and the students themselves. It's just something that we as PNHP locally and nationally should work to support. It's just such a great benefit for everybody.
Yes, I saw that John had his hand raised with the reaction. So if you guys have any comments, any examples you want to share, I think we're a small enough group that we can open it up to comments from any of you as we kind of go through this discussion. So go ahead, John.
Well, thank you very much. I want to thank all of you for doing this. I'm a semi-retired pathologist. I'm involved with the Medicare for All movement for well over 25 years. And to me, the activities of SNaHP are the most important thing we do. This is where the future is. And I think Ashley talked a little bit about a meeting with legislators. The legislators are more likely to listen to the people who are going to be the future doctors than listening to old people like me who've already been through their career. I spend my whole time now teaching medical students and residents at the University of Minnesota. And I just, we do have 3 previous interns from the medical school who are actually on our board now. We've done this for a number of years at PNHP Minnesota. We are going to have 5 interns this coming year from the first year class, and we're going to get them very involved in advocacy activity. And I just wanted to mention that I was able to establish a 3-hour panel discussion on this at the end of the first year medical student course, which will be on May 12th. And the medical school was very supportive of this. I don't think anybody ever suggested it before. This, I think, is an extremely important activity going forward. Thank you.
Yes, thank you for that, John. Anyone else have comments or questions or anything you want to provide? You can just raise your hand in the participant section or just use one of the reactions. But I think that was a good example, multiple examples of PNHP and SNaHP working together, either in providing an event or, making sure that there's a concrete role that a student can play on the boards to keep them engaged. I think another good example of PNHP and SNaHP working together was the AMA action in 2019. Although the Chicagoland students were brought in by the national office and included and kind of work with the national office, I think they made sure to state that they were prioritizing what we wanted with the action, what we wanted to do with it and achieve with it to really allow us to be involved. And of course, because of time constraints and just our very schedule, we couldn't attend every meeting and we couldn't figure out every single detail of this action. But I think, getting us involved from the very beginning and making sure to listen to us, to who else we wanted to bring in to the coalition, what we wanted to see on the day of, and getting people involved and turnout was really useful and helped all the chapters kind of come together. I think the Chicagoland Coalition was born out of working on this action together, and also helped us see that we can hold massive events like this, and we do have the stage and the resources through PNHP to be effective in our advocacy this way. So I really enjoyed that, working on that action, and I think a lot of SNaHP students saw the work and were really excited to continue working, and were kind of activated by doing something like this to continue to dedicate their time to single payer advocacy. Any other examples of effective collaboration between the chapters? I know that Western Washington also includes a student on their board. So any other ways that we can kind of get involved? I see Joseph has his hand up.
Yes, and this isn't directly addressing your question, but I just wondered, does SNaHP do outreach to other students, not just medical students? Because just medical students or doctors alone, I don't think will be enough to pass single payer.
Yeah, that's a good question. We do. I mean, we're students for a national health program, so we try to include students across the board. We have high school students and undergraduate students actually who are members. And then within leadership, we've had, of course, PhD students, public health students, nursing students. So we definitely do have students from across the board. It's just been primarily medical students that have been setting up the chapters and kind of recruiting in their medical schools. So we're hoping to expand the healthcare professional students that we include in our work. And recently we created an allied team this past year. Within the leadership teams, we have an allied team made of students who are in different health professions. And their job is completely about making sure that our messaging is inclusive, because sometimes we do tend to say medical student all the time when we provide any kind of messaging or language for students to use, and to also figure out ways that we can reach out to other students, either through their national organizations, through their school, etc. So we're slowly acknowledging and trying to bring up more students with different backgrounds.
I'd add to that, and Joseph, love the podcast. It's great to see your face instead of just hear your voice. So
well, thank you.
Thank you for the podcast. I think I was a little spoiled again being at Downstate. I was part of another group that was a interdisciplinary kind of multi-professional group, and so kind of just naturally brought people into the mix. And the PNHP New York Metro Board is quite diverse itself as far as physicians, nurses, public health professionals. So I think that's something that's still an opportunity for growth within SNaHP. So, I think it'd be great if you have any other ideas or connections. We do balance that we are a physician organization, and we still have so much we can do with physician organizing, but I absolutely agree. without other healthcare professions, this definitely needs everybody's involvement to win single payer. And Dr. Steve Auerbach, one of my longtime colleagues, friends, and mentors in our PNHP New York Metro chapter, talked about how we have a chapter at the public health school at Columbia, which I've given a talk to before. So that was a room of all just students who are in a master's in public health program and talking about dental schools and other outreach. And I think it's just so natural to just try to work to bring them in. And then they may, either incorporate SNaHP and that type of model into their own health profession school, or even what we've heard sometimes is they get inspired to, to create their own type of chapter around single payer. And then we're, sibling organizations working together, which is obviously wonderful as well.
Thank you for that. Yes, anyone have any other questions or comments? Yes, Betty?
Could you talk a little bit more? You said even high school students. Can you talk about that a little bit more?
Yes, actually, like one of the California, like the South Bay chapter was actually started by a high school student, and she's become very involved with SNaHP. She'll actually be helping with the summit tomorrow and presenting on like the single payer talk. So I think, as medical students and healthcare professional students in like our graduate degrees, it's been difficult to kind of go back and try to figure out how we can do outreach to high school students, and like they're a completely new generation now at this point. So I think it's been nice to have younger students on board, and I think she's been doing a great job. And slowly, especially with the past few presidential campaigns, Medicare for All has been gaining momentum, and younger students nowadays know what it means. So they're kind of seeking us out and trying to figure out how they can get involved. So it's been both like trying to do outreach as well as getting people coming towards us. So
I'd love to add quickly to Betty, one of our SNaHP leaders at the Long Island School of Medicine, they were introduced to PNHP before medical school in a mentoring program from public health professionals, physicians, family medicine physicians in the Bronx. And so it was kind of medical school outreach and mentoring programs. They would annually come to our PNHP New York Metro meeting, obviously attend the meeting, meet folks afterwards, and so now she's one of our amazing leaders. So it's so exciting to have seen that they reach out to people even before medical school, and so we were thinking, high school would be even a greater start too, right? College, even before we start them young, right? So.
And I see Pam has her hand raised.
I'm sorry. Yeah, I do. I was just going to say, Alankrita, I talked to you by phone, by letters before emails about the convention. So hello. But I was going to say that the other thing is the other people you can reach out to pharmacists and to pharmacy schools, because Shannon Rotolo in Chicago has done that too, because a lot of the pharmacists don't like how much prescription drugs cost. So, I think that's another good. And they're becoming increasingly more involved in the hospital setting. So, I think that's another group we could reach out to. That's it.
Yes, I know for a fact that we at least have one SNaHP student who's in pharmacy school. And one of the ways that we have been trying to kind of do this outreach, the Ally team has been creating like single pagers where they, and it's created for each of the professions, where they go through how, Medicare for All, like what their profession is dealing with currently and how Medicare for All would change some of these issues and really be specific to that profession. So within public health, within business, within as a physician assistant. So we're slowly starting to create this for each profession and hopefully, passing them around. So because we've noticed most of the materials we have really are kind of targeted at physicians and don't look at the reality that other health professions might face in their day-to-day life of dealing with patients and how Medicare for All would affect them. So really pointing out these little details of exactly what it means for their profession to have Medicare for All has been really nice. And it's been easiest to do with like business and of course public health, but we're slowly starting to create them for pharmacy and dental as well. Yes, Steve?
Hi, first of all, I'd love to work with you, and please, please, please share what you've got already on those profession-specific FAQs. The thing I ran into with dental, and your pharmacy one reminds me of it, is there are some professions that have elements to them that are more conservative than docs are. I think dentistry as a profession may be roughly where the AMA was some time ago. A lot of student debt on the one hand, and a lot of entrepreneurial orientation professionally. And then we just saw recently, probably you saw the article that's been circulating from The Intercept and others on the role of CVS as a pharmacy company. Never mind big pharma, but the drugstore company actively lobbying against single payer. So groups bringing in students, trainees, junior faculty, as the case may be, in professions where there are elements allied against us, perhaps on false narratives, to bring them in would be a great thing.
Just to add one more thing as well, I think at least my experience in the last couple of years within the PhD world, and I think that's also another underutilized schools that we can think of, because I think it's harder because they're not necessarily trained professional, like health professionals. But as we know, Rachel Madley, who's just an absolute powerhouse SNaHP organizer and Medicare for All organizer, is now I think a defended PhD. So she is now a Dr. Madley. But it's something that I've been on and off trying to do at NYU is to connect with their labor organizing in the various schools, because they actually have unions, right? And they're very sympathetic to Medicare for All. It's just oftentimes they're trying to negotiate back and forth with the schools so they can have a little bit of a capacity strain because they are trying to get working conditions and whatnot. But I think like if we want to even think about how we can not only collaborate with other students and other professions, but also like have that labor angle to it, if we can get in to some of these professions via the union. Like obviously the nursing union is like such an obvious example of how that collaboration is so successful. And I think as we especially think like, I know, Steve, maybe we can talk more. I don't know anybody, but the dental school is actually partly unionized recently at NYU, which is a huge deal considering it's a professional school, which is very unusual. So if we want to think about inroads to what, maybe not the profession as a whole, but which groups might be a little bit more progressive within this, profession, like do they have like more liberal versus conservative professional groups within it? We can maybe do a little bit of research so we're not, just broadly seeking out, but can be a little bit more targeted. I know I can follow up more in the years, but I've been trying to think like, maybe the union of the grad school is a little bit better than just any grad students in general.
Yeah, and please, folks on this call from either the PNHP side or the SNaHP side, please, either unmute yourself, raise your hand, comments in the chat. We'd love to hear more from you. I think one thing I've heard in the past is, okay, we have a medical student or health profession student who's come to our board meetings. What do we do with them? And that should be something that shouldn't be a question anymore. We've got way too many materials from PNHP and SNaHP and what to do at your medical school, ways to connect those folks who maybe be at medical schools that don't have SNaHP chapters, that don't have a lot of Medicare for All single payer activity. Please contact one of us in PNHP or any of your contacts, because I know Rich has worked on documents, Ashley, Krita, Kelsey, like we're constantly working on documents to give kind of like, here's a roadmap of what to do at your medical school or health profession school, and how to, what events you can have. Just a variety of resources at this point are just widely available. So if anybody needs that kind of help, please reach out.
Yes, I see, Betty, you put some questions in the chat to learn a little bit more about the logistics governance of SNaHP on the different on the different campuses. I mean, personally, myself and Ashley only have experience with SNaHP chapters on a medical campus. But essentially, when we help chapters become chapters and actually get established and do any kind of events or advocacy on their campus, we've found that it's generally the same from campus to campus, whether they're undergraduate or a medical school campus. They'll have their own administrative hurdles that they have to get through to become recognized as a chapter and part of the student body. And, we provide aid in that in any way that we can. I don't know if there are instances where we've had multiple chapters on like different campuses. I think at least in medical school campus wise, there are different chapters if there are different campuses for medical school. Like there's a UIC chapter in Chicago for both at Rockford and the Chicago campus. So we have two chapters there. And I don't know yet if we have a situation where we have an undergraduate campus chapter as well as like a medical school campus chapter. In general, I think when we do have a med school chapter that is very closely like in the same geographical area as an undergraduate school, that the medical school chapter also kind of works to make sure that the undergraduate chapter knows that there is events happening, that they can come over, that if they want to be a part of the chapter, they can. So I think generally we tend to work with all the students on a geographic campus that is nearby. So in terms of governance or anything like that, it hasn't differed that much. In terms of your other questions about politics in medical school administrations, it's all case by case. Some schools are very opposed to doing anything political, and they see, single payer reform as something that's very political, and that can kind of be a hurdle for some schools to kind of get over. I think Ashley has a personal experience with NYU being hesitant with some of the work that SNaHP was trying to do. I'll let her speak to that.
Oh yeah, sure. Yeah, so I mean, so it was more so a little bit of work we were doing tangential to SNaHP. We were trying to do via SNaHP and some other groups. NYU for a very long time had funding from a while ago, and a name of Sackler. So if people familiar with the Sackler family from Purdue Pharma. And so we spent a long time trying to get them to take down the name, in addition to some other demands that would have been more restorative. So that was not received well. So there's different, it depends on like exactly what we're doing, like, and we definitely are mindful about framing our events in a certain way. And at least my school, even for things like Single Payer 101, we don't necessarily name it or advertise it as Single Payer 101. We might be, we used to, have gotten more cautious over the years. We now try and frame it as like healthcare reform talk, right? Or something a little bit more neutral. And obviously we're not changing the substance of what we're going to talk about. Like Danny comes and he gives his very informative, persuasive talk on single payer. And, we acknowledge, the other reforms available as well, but it becomes clear once you talk about why they're insufficient. But yeah, there's, and I have talked to chapters as well, and I've continued to talk to NYU's chapters, both of them, both the Long Island chapter and the Manhattan campus about, realizing what environment you're at, and what battles are worth fighting and which ones are not, and which things that we can still get as many people in our SNaHP chapter, even if we name our thing for our budgetary reasons, healthcare reform talk, as we do, our more radicalized idea, even though it's not radical of an idea, but for, certain environments such as NYU, which is a more conservative campus. I know it's in New York City, but it is more conservative than other schools. That's just what we have to do. And I know the situation is the same, if not much worse, for certain schools. In the South, I've worked with certain chapters in the South that can be pretty hostile. So yeah, it's just a matter of thinking about how can we, protect our own students? Because especially, like, I've been mindful, a lot of the students who are involved in SNaHP often are underrepresented students as well. They're either are Black or Indigenous or other students of color. And so they're already so alienated within the school in general that it's really important to me that we can get them involved in SNaHP in a way that doesn't endanger them, because it is more dangerous for them to do any kind of work that is adversarial, either to the indirect or direct agenda of the hospital system. So so those are a lot of considerations, I think, especially when you're engaging with students. I guess for anybody if we're kind of getting back to the idea of collaboration, like really thinking about how can we develop students organizing and advocacy while also like understanding the limits and pressure they're under and some of the constraints, and how can I help, alleviate some of that. So I think that especially for students that are more marginalized in general. So yeah, I guess that's about my experience with that.
Yeah, I think since we have like 10 minutes till the end of this, I want to make sure that we highlight, the takeaways that we've come up with so far in this discussion. I think it's been emphasized that to really help get SNaHP involved with PNHP in a local area, it's very important to have concrete roles and that SNaHP students can engage in, whether it's like a position on the board, whether they're a liaison for all the different SNaHP chapters and PNHP. It's best to have an explicit role and tasks that students can do to keep that communication alive and keep them involved. And are there any other takeaways that people want to share?
I might add one thing we haven't mentioned. Please recognize that it is still very important to outreach to folks, especially students who don't know a lot about single payer and Medicare for all. I feel like I've seen such a broad range from starting in 2001 and standing outside a classroom and begging folks to come hear Dr. Ali Fine speak, and really more focusing on the pizza that is available, and medical students really at that time at Downstate not knowing what the term single payer or Medicare for all was at all. And then seeing over the years that evolve, and now at a point where students are teaching me a lot about the movement and answering a lot of questions that I still have. But then there's still a large number of students that come to medical school that we have to make sure we tap into. Really, again, the reminder of this is a caring profession that they went into. And I think sometimes what I've heard, it can be intimidating to be a medical student who doesn't know all about single payer Medicare for all, maybe still really new to it and doesn't understand all of the basics that many of us have come to learn over the years in doing our advocacy. So I think, while we're talking about maybe sometimes higher level organization with the students, sometimes those basic 101 talks, I know for me, when I was at Downstate, there were no pieces of the curriculum that covered any healthcare structure. So that Medicare, Medicaid, private insurance, that was what many of us needed to just learn about the basics. Now I've heard more medical schools have that, so certainly you can build upon that. But it's still, it's much more commonplace in public language, Medicare for all, but we really have to reach out to those who maybe don't know much, maybe know a little and pull them into the movement as well.
Yeah, I want to emphasize that I think a good way to get people involved and learning about single payer is first to have just general educational sessions on how the healthcare system works and what insurance is, on how physicians get compensated. Like, that's not introduced in medical school still. We don't understand what RVUs are until like we ask a doctor and they explain it to us. It's not part of our curriculum. So I think and so when you hold any kind of talk like that, you'll have a lot of medical students who haven't learned this, and it's really hard to understand some of this stuff on your own, who'd be willing to come and really, understand. And that'd be one way to kind of get them involved. Once they understand the medical system, they can understand that something needs to change. So I definitely want to emphasize that even if it's not a single payer 101, if it's just how does health insurance work? How does this health system work? 101, then that's always useful too. And I think, was mentioned in the chat, and it's definitely something that came up as we were organizing this event together, was, we're in a new world where you don't need a mentor, a PNHP mentor or a PNHP faculty advisor from the school that or campus that you're at. We're in a virtual world. And I think for the SNaHP students that are on this call, do not hesitate to reach out to any mentors that you see on the website, or to Caitlin to see if there's any mentors in the area. And then for PNHP doctors that really do want to work with SNaHP students but don't have a chapter nearby, definitely reach out to the SNaHP executive board to see how you can get involved, because there's plenty of chapters that would like mentoring and plenty of mentors that don't have chapters or outlets that they can kind of go out to. So I think over the next year it'll be good if we make that a goal of connecting PNHP doctors and SNaHP students together, so they can form that connection and start collaborating together and kind of maintain that relationship. And I think something Dr. Bruno mentioned before was about, that institutional knowledge. I think, a way that SNaHP can make sure that this relationship is maintained is to keep good documentation. So when we transition our chapters from leaders to new leaders, they know who are the PNHP doctors nearby, what is their contact information. Make sure the first thing you do after, as a new leader of the SNaHP chapter, is to get in touch with them, to introduce yourself, to learn who they are. And so then you can, start a new collaboration and come up with new ideas for events, et cetera. So I think documentation has always been important in what we try to promote as SNaHP, to make sure chapters can sustain and survive, each transition. But I think PNHP members can also serve as a good way of maintaining that communication. If something falls off the wayside, at least you are there at the institution for a long time, or in the area for a long time, and can make sure to reach out again to keep that relationship alive. So it's a two-way street.
I see we have a hand up. Is that Rohima?
Hi, Rohima, yes. That's right. Well, I just had a thought about if there's some difficulties with getting students sometimes because of the problem with student debt. I mean, I think part of the problem with our healthcare system is that doesn't exist in other countries, is that often people go to school all the way through whatever they need to do without the debt. And so how do you, and this is probably late to ask this, but dealing with the concerns that medical students, dental students, everyone have about how will they deal with that? How will they pay for that? I mean, I'm a psychiatrist, which, a lot of people won't go into that because they feel like they're not going to make enough money to pay off debt. We all pay the same amount of money to go to medical school, but if you go into a high paying field, you can pay it off. But if you become a family doctor, internist, or whatever, you're concerned about that. And they may have the same concerns about, a single payer system. So I think that is a big issue that probably has to be addressed with students in particular.
Yeah, I think you make a good point. Students are not completely completely blinded. Sometimes they can be led by misinformation about how single payer would lead to a big cut in their salaries and they're going to be saddled with this debt they can't pay back. They've definitely fallen into that trap many times. And I think it's important information to convey as a single payer supporter and a PNHP doctor to go out there and educate students on the fact that, if you're interested in primary care, it can actually be better. And I think a lot of students come into medical school interested in primary care and ultimately end up specializing for the reason of student debt. So I think, getting to them earlier on, M1 year, M2 year, explaining how the system works and showing them how under Medicare for All system with the emphasis on preventative care, their career as a primary care doctor could be better and more profitable than a primary care doctor now. So I think that's a good point you make, that's something that we need to make sure that we convey to students. Any other takeaways that people want to share to make sure that we have something that we can kind of follow through with after this session? I think one last thing, I think since physicians most of the time do spend more time in the community than students, and some of these students are moving from medical school, they're new to the area geographically, they might not know the community organizations that are working on different issues, they might not know how to really get in touch with the public and community if they are trying to move past their medical campus. So I think PNHP doctors can also serve as mentors for introducing students to the region, to the community, and the population, the patient population especially, and helping them find other organizations they can work with if they're particularly interested in other separate issues from single payer.
I'll just make a plug again. In 20 years of working on single payer, students have kept me going through the ups and downs of this, and they really, even with the tough questions like Rohima's bringing up and others, they challenge me to think about delivering the message in different ways. They challenge me to, teach it in different ways, but also, quite frankly, I think many of us on this call in leadership and attending physician positions, wherever our professions are, we often feel quite alone in this fight too. And so they have been so important for my own mental health of feeling like I'm not alone here, trying to do the right thing for my patients and society. So it's really just, I think, again, there's just so many benefits that can work for both sides of SNaHP and PNHP.
Yeah, I'll just I guess end with very similar things to Krita and Danny of just also thinking I just in my own experience, I mean, I feel like I came in with very clear vision of stuff, but I know a lot of my classmates didn't, even if they have these vague notions of what about my salary or what about these problems, they're actually a lot more flexible in what I mean, I did a lot of one-on-ones with people, which some of people, it did not work. But what I'm saying, especially if it's coming from what they perceive as an authority figure, that is very influential, especially they just, are coming into what they're going to believe in the medical system and what kind of doctor they want to be. And they're very primed for inspiration, especially it's very demoralizing sometimes, medical school. So having the people you want to be is so important. And I think there's a lot of room, even at this stage, it gets harder each year, I think, but it's much, I think, easier to convert students than it is maybe tenured doctors who have, concrete experiences that may lead them one way or another. But getting at the students, and that might mean reaching out, even if you're not, it might be easier if you're an academic physician to just say to I don't know, the administration, what kind of clubs are here, and figure out, is there a SNaHP chapter, is there not, or are there allied kind of clubs, and reach out to them that way if you're really not sure. Or even if you interact with students at all, you could ask them what kind of clubs do you guys have? I would love to talk about healthcare policy. Definitely don't be shy, because students are going to be a lot more shy asking you for that stuff, because we're often told about etiquette and professionalism and don't cold call these people or cold call these people. So on our end, it feels a lot more tricky navigating that, versus if you just kind of ask students what's the deal, they're much more likely to give you the information and you can take the initiative, which I know can be difficult. Everybody's busy, but yeah, I would advise that if you're really looking to engage students, like they want to be engaged, especially with somebody that they might want to work with. So you have a lot of influence, so don't be shy about it.
All right. Well, thank you so much for attending this session. I hope people got some useful information and good takeaways to help you not only develop your PNHP chapter, but also kind of start doing some collaboration with SNaHP students in the area or in any place, since now we can be virtual. It was put in the chat, but we do have a socializing session between PNHP and SNaHP that is happening this evening in 15 minutes. So the link is in the chat again. Make sure you join us. Thanks, everyone.